So pediatric Crohn's is a subset of a larger problem known as Crohn's disease. This is a inflammation of the gastrointestinal tract. They can occur any time of life. Actually has two bumps, if you will, in instance, young people and then in the 30s and 40s. Basically, this is a condition where patients will have intermittent flares where they get severe abdominal pain and diarrhea. It also leads to long-term complications such as stricture of the bowel, fistula formation, etc. Although we use the same term in both pediatrics and adults, it turns out pediatric Crohn's disease is somewhat different than it is in adults. In adults, usually they have most of their disease in the lower GI system. In pediatrics, it's both upper and lower in a significant portion of those patients. One of the problems is that the treatment which is currently used to treat flares is systemic high-dose steroids. High-dose steroids are very effective. The problem is they carry with them significant safety problems. Long-term use can cause bone demineralization. It interferes with the normal hormonal balance in these patients. And in many cases, this is much, much worse than kids, if you think about it, because they are growing. So that any sort of abnormality of bone metabolism can leave you with a short person. So pediatricians have been trying for years to come up with treatment modalities which can limit this amount of side effects. The only thing that's approved in pediatric Crohn's are the biologic anti-TNFs, Humira and Remicade. Again, these are very effective drugs. The problem is they carry with them a black box warning, basically saying that using this drug can increase significant infections and may cause secondary cancers. If this is a 1 or 2 use, that's not a big deal. If you think about, though, a child who is 7, 8, 9, 10, who are going to have this disease for the rest of their life, parents are very, very reluctant to put them on this sort of medication. What we have is our drug is beclomethasone. This is a very old steroid. It's been used for the last 40 years for asthma. We have a unique formulation that allows us to give it by mouth in a 2-capsule form so that it actually gives you very high doses at both the upper and lower GI without very much of the systemic absorption, so that we get most of the steroid effect with very little systemic side effects, so that we believe that this has a great potential for this particular disease.